contributing their time and particularly their money to large aid organizations. How does PSI address that?
Sure. So to answer the first part of your question, things are working. So we've cut child mortality in half. We're talking about eradicating polio. Eliminating malaria is within reach, and for the first time in history, we're talking about an AIDS-free generation. So it's working, and big NGOs are part of that. And I think what makes PSI unique is a couple of things. The first, we act a lot more like a business than we do a nonprofit, and by that I mean we use marketing, franchising, and we are obsessed with measurement. We measure everything. And the second piece is we employ about 9,000 people around the world.
That's incredible.
98% of them are local to the communities and countries where we operate. So all the solutions are developed locally so that they're relevant culturally, they're effective, and they're more sustainable. So those are a couple reasons I think that works.
Mm-hmm. Mandy, how can you help support what Marshall was just saying? What have you seen because I know you've gone out and been on the ground quite a bit.
I've been on the ground with PSI. I've traveled to, my first trip was to South Sudan, and I've been to Cameroon and the Central African Republic, and we went to Myanmar last year.
Wow.
I mean, I think one of the things that really sets PSI apart in my understanding, what I've seen and I've been super impressed by is what you mentioned it briefly, but is this idea of social franchising.
Right.
So in the same way that, a fast food company would franchise a restaurant, PSI franchises private clinics and pharmacies and kiosks in some of the most remote and rural parts of the world. And I actually got to see this in effect in Myanmar when I was there last year. There's a franchise network of clinics there called Sun Quality. And there's about 1,500 clinics around the country, and they're sort of supplemented and supported by 2,000 community health workers as well. So it's like all these previously disjointed, disconnected ways for people to get healthcare suddenly are sort of brought together. They're tied together and branded.
Marshall, you've started a pretty interesting initiative amongst men in some of these developing nations. Can you talk about that?
Sure. So, this is it's an interesting story, but male circumcision is an effective tool in HIV prevention. It can reduce the likelihood of transmission by 66% from woman to man. Mm-hmm. And so the evidence was there that it's an effective tool, but what nobody believed that demand could be created because, it's elective surgery on your penis, mm-hmm. right? Like, are people going to line up for that?
I've heard of it. I've heard of that elective surgery.
And so what we did was pilot out some projects with partners to create that demand. And once we did, it unlocks some additional funding.
So how do you how do you create the demand for somebody to snip their penis?
All right, Mandy, I got to ask, you're not on the billboard, are you?
There you go. That's a great question.
People are lining up around the block.
Is this what you're involved in? Is this your media effort?
I maybe go more on the child survival program, not so much male circumcision.
The interesting thing that I found, and Mandy and I have talked about, is when people understand what they can do to improve their health, they want to do it. Yes. So part of that demand creation is people have seen a lot of people die, and they want to take care of their health.
Thank you so much, both of you, for joining us.
Absolutely.
Congratulations on a really great initiative. And learn how you all can join Mandy Moore and Marshall Stowell in their efforts. Visit PSI.org, and to learn more about how male circumcision is helping to curb disease in Africa, visit TakePart.com/world.